University of Michigan Teaching Hospital, um, Bronson Hospital also. I was invited here to give a talk on cancer prevention, and so hopefully we're able to take some key facts, things we can use, and also help other people with. It's been a passion of mine, medical education, making sure that medicine is easy to understand by lay people. It's easy for them to implement because that's what makes the greatest impact on healthcare. The biggest thing you can do for your health is done before you even get to the hospital. So let's get started with it. What is cancer? First of all, cancer is scary. I have had to deliver the news a couple times, and it's very unfortunate because cancer is one of those diseases that almost becomes our identity. No one says I'm a pneumonia patient. No one says um, I'm a tuberculosis patient in social gatherings, but cancer is one of those tags that unfortunately stays. And it's hard to, get out of mentally, socially, the stigma of it. You're wrapped in this constant circle of pity. So we're going to break it down what it means medically when they say you have cancer. When you're diagnosed with cancer, basically what it breaks down to is that you have some cells in your body that are growing uncontrollably. Now, usually growing and dying is part of our cell cycle. We need some cells to grow, like our hair cells, our nail cells, and some cells have to die, like the cells in our intestine. Um, so cancer is usually when the cell doesn't follow the pre-laid protocol and it grows uncontrollably. And this is bad because it uses up the nutrients that are meant for healthy cells. It crowds out healthy cells, stopping them from performing their functions. And that's when you start to see the clinical presentation of cancer. And worst of all, it can be malignant where it spreads to other locations as well. Why should we care about preventing cancer? Because cancer is the second cause of death worldwide, second to heart disease. In Nigeria alone, we have over 124,000 new cases of cancer each year, and about 78,000 people are dying from cancer each year, which means, based on this statistics, there's a 70% chance that people diagnosed with cancer will die of cancer in the developing world. And so it's important to know what we can do to prevent this from happening. It's very unfortunate to have cancer be the reason why the people we love are taken away from us, why people don't fulfill their potential. What do we benefit from preventing and treating cancer early? If your cancer is diagnosed early, you have better treatment options, you have more options. Your prognosis is improved, which means you have a higher chance of living. Some cancers are not even, they're not morbid once they're diagnosed early. You just have the surgery and it's done with. The treatment is less aggressive if you catch it early. It's cheaper to treat it if you catch it early, and you just have peace of mind. It's easy to have it treated when it's diagnosed early. So these are just numbers from the Global Cancer Research Institute. As of 2014, we were having 102,000 new cancer cases per year. And as of 2018, it's increased to 124,000. And this isn't good news for Nigeria in particular, mostly because we are getting better at detecting and treating cancers. So while other developed countries are having a decrease in their incidence and a decrease in their mortality, ours is actually going up. And as you can see from my figure on the right, the pie chart, breast cancer is the most common, mostly found in women, and then you have prostate cancer is the second most common, and it's the most common for men. When we break down the statistics, we see that men mostly suffer from prostate and colorectal cancer, while women mostly suffer from breast and cervical cancer. So I will be going through each of those four specifically to see what we can do to prevent them and what we can do to screen for them. What causes cancer? There are many different causes of cancer. We have intrinsic causes, which are basically things that you cannot change. Your genetics. So some people are predisposed or have a higher incidence of having cancer just due to their genetic makeup. And this is where family history becomes important. It's important to know who in your family has cancer because that information can save you. We need to work to break down the stigma of talking about our health, especially when it comes to deadly conditions like this. Your age, you can't change your age. On paper, you can, but biologically, you cannot. And unfortunately, as you get older, your risk for cancer increases. The cells just get older, they tend to collect more mutations that make them prone to cancer. Your gender, certain genders are predisposed to getting certain cancers, like we've seen in the statistics. Women, you're more you're basically prone to getting breast cancer, and men don't have to worry about that. And then the reverse is true for prostate cancer. And hormones, we're starting to find out that estrogen and progesterone really plays a role in getting certain cancers, endometrial cancer, breast cancer, and sometimes cervical cancer. Now we have extrinsic causes. These are things you can change. Mostly your diet, your environment, um, obesity, occupational exposure, exposure to viruses, exposure to sunlight, and pollution. I know Nigerians say we don't burn, but you still need sunscreen to prevent from cancer. So let's please try to get into that habit of using sunscreen if you're going to be out for a long time. And this is just the last bit of statistics I have. This is from the World Health Organization, and they just did a study to find out of all these environmental causes, which one contributes most to cancer. And as you can see, for men, tobacco and alcohol use by far um, contribute or increase your risk for cancer, while for women, it's tobacco use and unsafe sex. And as we go through each of those cancers, this will start to be more clear. So we're going to start with breast cancer, just because it's by far the most common. 1 in 8 women in their lifetime will get cancer, breast cancer. It could either be a benign variant, which means the cancer doesn't grow and spread to other places, or a malignant variant where it grows and spreads to other tissues. As of the 2018 statistics, we're getting over 28 new cases per year and 14 deaths per year, which means right now, a diagnosis of cancer is given a 50% mortality rate. We have been able to make some advances in this statistics. We know that just having breast cancer screening. Sorry?
Sorry.
Okay, so from the advances we've made in breast cancer screening, we've been able to drop the mortality from breast cancer to 49%, although this statistics is now mostly seen in developed countries. We know that breast cancer increases with age because a third of women over 75 will be diagnosed with breast cancer. All women are at risk. Some women are more at risk than others. If you have aunties, grandmas, or you have a mom with breast cancer, then you're genetically more at risk to get breast cancer. And I just wanted us to at least know the malignant lobular or invasive cancer. Those are malignant variants and should be taken more seriously. What are the things we can do to prevent breast cancer? The first thing is eating healthy because obesity does contribute to breast cancer. We know now that obese women produce more estrogen, and estrogen is a growth factor that promotes the breast cancer cells to become cancerous. Smoking is also a risk factor. You need to limit your drinking, regular exercise, limit hormone therapy, and that's mostly birth control, limit exposure to pollution, and breastfeeding. And these are all primary prevention tactics, which means there are things you can do to stop your risk of getting breast cancer in the first place. Now we have the secondary prevention tactics. So these are things that we do to catch the breast cancer as early as possible to make sure that your treatment is less aggressive, cheaper, and all those benefits that I gave earlier. So, um, ideally, your screening should begin once you're in your 20s. Um, and you get that by having a health assessment done by a doctor. They should be doing a full breast exam every year from age 25 and upwards is the new guideline. By age 40, you should start looking at getting an annual screening mammography, which is basically an imaging they take of your breast. It's a special MRI of your breast, and it looks at the breast tissue. And from the way the tissue is on the MRI, they can see which ones are starting to turn cancerous. And you have this screening done up until your age 75. Now, the old guideline is at 75, you can stop. But now we're starting to see that even past the age of 75, women still get benefits from having breast cancer screenings. So you can still, there's still hope for grandmas out there. Encourage them, talk to them to get breast cancer screenings, even the ones above 75. The most important secondary screening or secondary prevention technique we can do is a self breast exam because this is the cheapest, the most convenient thing you can do to assess your risk for breast cancer. And I'm just going to walk us through how to give yourself an adequate breast exam. You want to do it at the same time each month. And this is because the composition of the breast tissue changes with your menstrual cycle. And so what you may be picking up as a lump might just be your breast tissue reacting to the hormones from a surge in your menstrual cycle. And so if you pick 1 week before your menstrual cycle to do a breast exam every couple months, you want to stick to that schedule to make sure that your assessment is accurate. Secondly, you want to look preferably at a mirror so you can see and gauge where you're touching, because if you feel something, you want to be able to describe where or what you found to a doctor to be able to assess for you. Thirdly, you want to use the tip of your fingers because those are the most sensitive. So you're most likely to feel something if there is something with the tip of your fingers. And you're looking for anything that shouldn't be there. A lot of things are intuitive. So if you feel a lump, um, sometimes you can get dimpling of the skin, and that's basically when the nipple retracts into it. Um, Sometimes you can get soreness, you can get pain with touching, and those are all red flags you should look for that tells you I need to go see a doctor. You want to make sure you're touching all the way to the outer edge right underneath your armpit because you do have breast tissue and breast lymph nodes that go all the way there. And actually, most of the breast cancers start on the outer edge of your breast. So you don't want to neglect the outer edge of your breast all the way up until your armpit when you're doing the breast exam. You're also looking for changes in the appearance of your breast, which is why it's important to do it in front of a mirror. You want to make note of discharge, watery or bloody. You want to make note of either sores or just the changes in appearance and texture. So I'm going to give you an example of the kind of things we're looking for. This is an example of nipple retraction. I just used this one because I find that this is the hardest for patients to imagine when they're looking for something. They know what lumps, bumps, sores look like, but this is what nipple retraction looks like. And this particular lady has inflammatory breast cancer. We call it peau d'orange, which means the breast looks like an orange pill. So that is a very bad sign, and you should definitely go see a doctor. If the skin of your breast looks like an orange pill with the enlarged pores. Okay, so just to review what we do for screening of breast cancer, primary prevention, your diet, limiting hormone treatments, eating healthy, reduced smoking. Those are things you can do to reduce your chance of getting it in the first place. And after that, the best thing you can do is screening, which means going for screening exams by professionals, your annual breast exam, your mammography, and then also your consistent self-examination. Okay, so we're moving on to cervical cancer, which is the second most common cancer for women in Nigeria. And this one is actually one of the more unfortunate ones because um, in the developed world, cervical cancer is now 100% preventable, but we're still having to deal with it in Nigeria due to lack of resources, low level of education. So I'm just going to start with a visual orientation of where the cervix is. So this is a uterus. Let me see. Sorry, I'm trying to see if I can get the laser pointer working, but I don't think I can. Okay, let's see. Okay, so this is the uterus right here, and this is the vagina, and basically the cervix is the area that connects it. And a lot of people are familiar with it, they just don't have a visualization of it. So if someone has gone into labor and they say, oh, she's 5 cm dilated, they're talking about the cervix. Oh, she's 10 cm and ready to give birth, they're talking about the cervix. And that is the area that is also most likely to get cancerous in the whole reproductive tract. Okay. But why should we care about cervical cancer? Because even though it's a receding cancer in the developed world, it's still very common in Nigeria. We're getting over 12,000 cases per year, and unfortunately, over 7,000 deaths per year from cancer. So we're talking about a greater than 50% mortality rate of dying from cervical cancer if you're diagnosed. And this is unfortunate because it's now very easy to diagnose, very cheap to screen for, and very easy to catch. Most cervical cancers will be caught before they become malignant if we're following the proper screening procedure. Okay, so the risk factors for cervical cancer, the biggest and by far is herpes virus, human papilloma virus, which is usually sexually transmitted. The cancer-causing variant is sexually transmitted, but it's also the disease that causes warts on people's legs, on people's skin, although that variant is not cancer-causing. And so all the effort put into reducing cervical cancer has been put into reducing either the spread of HPV or catching HPV before the patient becomes cancerous. We also have smoking that contributes to cervical cancer and immunosuppressed patients. So mostly HIV positive patients in Nigeria would be at increased risk for cervical cancer as well. So for primary prevention, the best way to prevent cervical cancer is the HPV vaccine. Now, this is the vaccination recommendation from the World Health Organization. And I just want to draw your attention to the HPV column. You have girls from age 11 to 13 should be getting the HPV vaccine. So they get the first dose at age 11. And now they're saying we can even start as early as age 9. If we're worried about losing them to follow up, we can start at age 9. And then 2 years later or 18 months later, as early as 18 months, they can get the second dose of the HPV vaccine. And basically what that does is it primes them to fight the HPV infection if and when they get it in their later years. Now, because this vaccine has been so successful in reducing the risk for cervical cancer, the WHO has also recommended that women up until the age of 26 can get the vaccine. So if you have a 24-year-old, a 25-year-old, 21-year-old that has missed the ideal vaccination window, they are still going to benefit from getting the vaccine. And even now, they have studies showing that women up until the age of 45, benefits from getting the vaccine. And so those women are eligible to get the vaccine as well. Now, the secondary prevention, which is what we do to catch the cancer in the earliest stage, is the cervical cancer screening test, or the pap test. And surprisingly, I've spoken to a lot of women, and there's some hesitation about the pap test, especially in younger girls. I find that they have questions about would I still be a virgin if I get the pap test? Um, the pap test does break the hymen, but I feel the benefits that outweigh the risk. Cervical cancer has a 50% mortality rate. And if we're talking about the spiritual implication of being a virgin, I think you would still very much be a virgin. You would be surprised how many people would ask you that. So when you're educating people and pushing for people to get a pap test, just be ready to answer that question. So basically, the pap test is them going to the cervix with a speculum and just sampling the cells there to see if any of the cells are cancerous. And we find that this test is over 99% sensitive at detecting cancer. Now, the screening guidelines by the WHO recommend that women from 21 to 65 should get the pap test. Now, there are two ways to do it. You can do just the pap test every 3 years from 21 till you turn 65. And you stop at 65 if your results have been clear. So that means if at any point the woman gets a screening or a pap test and they find cells that could be cancer, she has to continue past 65 until she's cleared by the doctor. Or you do the pap test and HPV testing together, and you just do that every 5 years from age 21 to 65. And the same rules apply. You stop at 65 if you have been clear for the last few visits. Now, usually what most people find are precancerous cells. And once the precancerous cells are found, they go in with an ablator. It's basically an electrical device that kills the cancerous cells in that area, and that is the treatment. It's very easy to treat in the very early stages. Now we move on to the male cancers. I'm going to start with prostate cancer, which is the most common one in Nigeria. So to orient ourselves to know what I'm talking about, this is the prostate. It's a sexual organ, but because of its anatomical location, the urine tract, the urethra, comes right through the prostate, which means when the prostate is enlarged, you would have urinary symptoms as well. And so because of that, people tend to think it's a urinary organ. It's not. It provides a nourishment, and it neutralizes the pH of the semen to make sure that it's optimal for fertilization. So just some statistics about prostate cancer. It's the second most common cancer in men worldwide, but for Nigeria, it's the most common. We have over 15,000 cases of prostate cancer per year, with over 8,000 people dying. So also greater than 50% mortality. There is an increased risk in men of African descent. So that genetic factor comes into play again. If you're an African, you have to take your prostate cancer screening more seriously than the average person. There's an increased risk with age, and studies have shown that after age 50, your risk for prostate cancer is basically your age. So if you're 55, you have a 55% risk of prostate cancer. If you're 70, you have a 70% risk of developing prostate cancer, and it has been strongly linked with smoking. Now, for primary prevention of prostate cancer, what can you do to reduce your risk of even getting it in the first place? The first thing is physical activity. Obesity is an important risk. It increases your risk of developing prostate cancer. Bad food, so food high in saturated fats, food high in carbs increase your risk for prostate cancer. You need to limit red meat and processed meat consumption. And how I usually tell this to my patients is if it walks on four legs, it's probably not good for you. You want the meat that walks on two legs. So chicken, turkey. Um, and then you also have to avoid smoking and alcohol consumption. Now, for secondary prevention, um, the best thing to do for prostate cancer is a regular prostate check. And actually, once you're 50 and above, with every doctor's visit, your family doctor should be checking your prostate yearly. And it's done via a digital rectal exam. Now, because of the nature of the exam, there is a lot of pushback in getting patients to do this screening. So a digital rectal exam entails the physician going in with their fingers through the rectum. And because of the location of the prostate, it's right behind the rectum. We can actually feel for the prostate with this exam to check if it's normal size or enlarged. And so that is why we do that exam. We don't like making patients miserable, but this is the cheapest and the easiest way. Um, and it's easily done with a simple doctor visit. It's also important to know what are the signs to look for because depending on the type of prostate cancer you get, it might not even be palpable. So the signs you look for are frequent urination, difficulty starting a urine, blood in your urine or semen, pain with urination, persistent back pain, pelvic pain, or thigh pain. And what happens is if you develop any of these symptoms, they will do a prostate PSA blood test to check the levels of your PSA. It's a hormone made by the prostate, and we find that patients with prostate cancer produce a higher amount. So to review for prostate cancer, the best thing you can do before you get to the hospital is diet, watching your diet, exercise. We need to cut back on alcohol and smoking. And as you can see from just going through each of these cancers, you can see why alcohol and smoking contributes such a huge amount to one of the causes of cancer. So finally, the last cancer I would be looking at individually is colorectal cancer, which is the second most common cancer for men in Nigeria. And just again to know what we're talking about, this is the digestive tract. And over here is your colon. It goes like this, and then it comes like this. It goes and it feeds into your rectum. So any cancer that develops along this tract is what we call colorectal cancer. It's one of those cancers that can be very debilitating. Patients lose ability to perform bowel functions. There's a lot of stigma associated with it. And most patients with advanced prostate cancer would have to use a osteotomy pouch, which is the pouch that collects the pieces in an outside bag. And you can see how that can be an embarrassing thing to deal with for the rest of your life, especially when it's diagnosed early. Okay, so just some important stats and info. We have over 3,000 cases of colorectal cancer per year. So it's on the smaller side, but what makes it concerning is the death. So there's a 72% mortality rate for colon cancer, which is also quite unfortunate because colon cancer is one of the cancers that we've been getting better at diagnosing in the very early stages and even screening for. Um, and as you can see, the higher mortality rate is just due to lack of screening. It's also associated with age. So 90% of colorectal cancers occur in people that are 50 and above, and that's why we start to screen at 50 and above. There's also a significant genetic component. So if you have uncles, brothers, cousins with prostate cancer, you should definitely be on top of your screening schedule. You're not an average person, you don't have an average risk. And then we also find that there's an increased risk with those with any form of inflammatory bowel disease. So that includes Crohn's disease, ulcerative colitis. We actually start to screen for those people earlier. So what can you do to prevent colon cancer in the first place? If diet matters for any cancer the most, it's this one. Your colon deals with basically the waste of your diet. So if you're eating a lot of processed foods, which we are now finding that the preservatives in processed foods tend to be carcinogens, then all those things kind of accumulate in the colon because that's where the waste stays. And so the colon is more exposed to this and it's just more likely to be um, malignant or to develop a cancer. You want a diet that is high in fiber because that helps your bowel movement, it regulates your stool cycle. You want a diet that is high in vegetables and whole grains as well, and to decrease the consumption of processed meats, red meats, and foods high in saturated fat. You also want to avoid drinking alcohol and smoking tobacco as well. Now for colon cancer screening, um, we have multiple options. And unfortunately, as the convenience of those options decreases, the sensitivity increases, which means the least convenient tests are usually the ones that are the best and most recommended. So I'll start with just a general guideline. An average person, so average risk, nobody in your family that you know of, then you should start your colon cancer screening from age 50 and onwards. And just for my family alone, I can tell you people are not doing that. And even when they know, it's kind of hard to push them to make that step. So I will say this, it's better to do a less sensitive test than to do no test at all. If you do have a family member that was diagnosed with colon cancer, you want to start screening 10 years before that person was diagnosed. So if I have a cousin that was diagnosed with colon cancer at 51, I'm not going to start screening at 50. I'm going to start screening at 41 at the latest. And what the screening does is it lets us detect polyps, which are precancerous cells. So they're not quite cancer, but from studies we know that polyps do eventually become cancer. So what we're doing is we're looking out for these polyps and taking them out before they even get the chance to become cancer. And so on the right, we have some testing options. The first one is the fecal immunochemical test. And basically, you send a stool sample and we check for immune markers that tell us that you're actively trying to fight a cancer. The second one is stool DNA test, also done by sending a stool sample. And basically what we're looking for is traces of blood, red blood cell DNA in your stool, which tells us that you're bleeding from your colon, which is an early sign of colon cancer. And these ones, because they're not very sensitive, you have to do them more frequently. So actually, even the stool DNA test we recommend doing every year now, the 2023 guidelines. And then secondly, we have direct visualization tests, which nobody likes because we have to put a scope through the rectum to see for ourselves what the situation of the colon is like. So the first one is the flexible sigmoidoscopy, and that doesn't go very far. So it stops right at the intersection between your rectum and your colon. And basically, that test is an option for those that were not able to visualize the whole colon. So people with irritable bowel disease, people that have had surgeries. And we do that test because that's where most of the cancer concentrates. So if we're able to detect cancer, at least in that area, it reduces your risk of the cancer becoming something that is aggressive. But the best and by far the most recommended is the colonoscopy, which is the same idea. You're putting a tube, but we're taking a look at your whole colon. And usually what we're saying, checking is, are there any polyps? Is there any bleeding? Are there any striations? Anything abnormal that we should treat now while it's still benign? And lastly, you have the CT imaging, This is very new, so it's still very early stages to determine how good of a test it is. But basically, they fill your colon with air, and then we use a CT scan to take a picture of it, and it gives us um not as good as an image, but it lets us detect really big polyps, but the smaller polyps not as much. So now that I have gone through the four most common ones, things we can do to prevent and screen for them, I just wanted to have a reality check of what is actually going on. So on the right side, we have the National Cancer Control Plan, their objective for 2022. And then we have the reality, which is the um, World Health Organization's actual assessment of the services that were available and the impact of that on the economy. And we are not getting nearly close to 50% of people screening for cancers, which is unfortunate. So I just want to reiterate the strategies we can take to reduce our risk for cancer in general. The first thing is to educate yourself. Um, the best thing you can do is to know what you're at risk for. People don't like to find out, people don't like to ask family members, but I really, really, if anything, one thing you can do that is cheap and easy is to talk to family members. What do you have? What are you going through? And just encourage them to share. And then we can also just um, create an environment by sharing ourselves. We also have to make sure that we bring the process of education and awareness to schools, community healthcare, and healthcare settings, making education a part of every doctor's visit, having healthcare screenings in schools, and not just administering vaccines, but educating the students on why they need these vaccines, um, and then educating them on why it's important to have a healthy lifestyle. I know when the HPV vaccine came to my school, a lot of parents were against it because they were worried that having the vaccine would make daughters promiscuous. And it just shows you just how much education has the power to just affect healthcare outcomes for people. And then secondly, smoking control. Besides the four cancers that I spoke of, smoking also affects your risk for liver cancer, affects your risk for lung cancer, affects your risk for stomach cancer, affects your risk for bladder cancer. And even though those cancers are not as common, they're even far more deadly than these ones. And so, honestly, there's no reason to smoke. There's no benefit from smoking that outweighs the risk of all the cancers that you're exposing yourself to. And besides cancers, smoking reduces your risk for your ability to heal yourself. So if you've had surgery and you're smoking, your wounds don't heal as well. It causes your blood vessels to tighten up. Smoking increases your risk for hypertension. Smoking increases your risk for stroke and smoking increases your risk for heart attacks as well. So besides the benefits of reducing cancer, there's just more generalized healthcare benefits from reducing smoking. And the best way is to start when people are young. Education before they even pick up the habit is way easier than trying to get someone to quit once they are already addicted. The next thing is health and physical activity. Um, Promoting the importance of a diet rich in fruits and vegetables. Now, I know, well, in Yoruba culture, meat is where the party is at. Everyone loves different kinds of meats, and fruits are not given as much love. But ideally, your plate should be half vegetables, quarter meat, quarter starch. So, and what I'm about to say is very true, very, very true. If you're eating starch, swallow, your serving size should actually be the size of your fist. That's an ideal serving size. So your starch should be the size of your fist, your meat should be the size of your fist, and then your vegetables should be twice that. Now it's hard to get people to move from one extreme to another, but even minor changes helps. So gradual changes, even if it's just slightly less, as opposed to just cutting it out completely. And then also regular and physical exercise is very important. A lot of people are able to get this just from the nature of their jobs. But if you're working a white collar job, an office job where you're sitting down and typing all day, or just sitting down and writing all day, then you need to take more proactive role in making sure you're meeting your physical activity. Now, the World Health Organization recommends 150 minutes of physical activity every week. So that can be broken down into 5 sessions of 30 minutes or 3 sessions of 1 hour. And then education on good nutrition habits in school. It's easier to mold young minds than it is to retrain older ones. And then obviously the next thing would be vaccination, HPV, HPV, HPV. We have many organizations now that provide free HPV vaccines, and I will be stating some later on, but also hepatitis B vaccine. I know I didn't talk in depth about liver cancer, but that is one of the greatest risk factors for developing liver cancer. Second to alcohol use is hepatitis B. And then finally, environmental protection. We live in an industrialized world, which means a lot of our machines are producing toxic fumes, our cars are producing toxic fumes, our industrial plants are producing toxic fumes. And so, personally, there is not much personal responsibility you can take to tackle this. All these things are tackled via policy and advocacy, pushing our government to make sure that these companies are properly disposing of their waste and not dumping toxic wastes into the air. Now, there are many challenges to healthcare. As you can see, the cancer statistics for Nigeria is very different from that worldwide, and it's due to certain factors, lack of information, some stigmas, attitude to different screening methods, lack of funding to build infrastructure, expensive healthcare, lack of trained and compensated staff, and just healthcare not being a national priority. And so, unfortunately, we have gotten to the point where sometimes we have to rely on international organizations, NGOs, and just private sectors to pick up the inadequacies that our government has created for healthcare access. So these are some of the big non-governmental organizations that I could find that are pushing to make cancer screening more accessible, easy to understand, and as cheap as possible. So the first one is Project Pink Blue, and I can post their website in the chat once the presentation is over. And the second one is Cancer Aware, although they focus on just breast and gynecological cancer. And then the third one is BRCAN, Breast Cancer Association of Nigeria. So just to reiterate, the best way to reduce the risk for cancer is to empower ourselves. Personal responsibility will go a long way in reducing your risk. There are things you can do to change the situation. You can't change your genetics and your age, but how you eat, what you expose yourself to will go a long way. I am not sure we have enough time, so I'm just going to do just one case just to help us see how all these things play into, I guess, a simulated person. So the first case I have is Miss Abiola, a 63-year-old woman living in a rural community in Ibadan. She has been living alone since her husband passed away 5 years ago from colon cancer. She has 5 grown children who live in different cities but visit her occasionally. So some of the challenges she faces, she's an older woman, she's in a rural community, so very little access to healthcare. She lives by herself, so we don't know how much socialization, how much education is reaching her way. Her children are far away, which means she has very little options on people who can take her to doctor's visits and screenings and stuff. Um, and so what can she do to be proactive about her health? For Miss Abiola, a 63-year-old woman, The first thing is to make sure that her 5 grown children know about her husband's passing from colon cancer, because those children will be at increased risk and should start their own screening early. So that education factor comes into mind. She is 63, so we should try to get her as much as possible to a breast cancer screening. We need her to get a pap test for cervical cancer screening, and then we need to educate her on the importance of fruits and vegetables, trying to maintain as much mobility as she can in her old age, and trying to exercise as much as she can tolerate in her old age. I'm just going to skip through the other cases. And that is the end of my presentation. Thank you for your time.
Thank you so much. Thank you so much, Dr. Showmi. We've really been enlightened and educated on how to prevent cancer. That was really an eye-opener. Thank you very, very much, ma'am. We are really blessed. So we want everyone to come up with a question. If there's anything that we want to ask questions on this